Okay. All right, we're here again. Sorry to bombard you today, but I've been on vacation for a couple of weeks, so we're back at it this week. We have another very special patient. This is Glenny's and her friend that brought her in. Anytime we do sedation for a patient, someone has to bring them in, so they choose someone that they care about to bring them in. So thank you for being with her.
Oh, you're welcome.
Now we did, this is unusual because we've been doing reveals at the final delivery, just because so often people are a little bruised after surgery. So I like to wait until the final teeth that we get, because we'll dial everything in and make them just absolutely perfect. But in your case, you're doing really well. You're very comfortable. A little bit of bruising. So for those of you out, we did surgery yesterday for top and bottom. Now Glenny's, am I saying it right? Glenn, is it reconnecting? A lot of times it will save it, but basically, let's just kind of go back to the beginning. You know, what were the things you were dealing with that made you come in to see us?
My teeth were, I had a partial.
Yeah.
The teeth on each side were really, really loose.
Yeah.
Infected. The bottom ones were so ground down that they looked like little tiny baby teeth.
Little chiclets, huh?
And
Yeah.
I couldn't eat. I mean, I couldn't chew properly.
Yeah.
It was hard. So finally it got the better of me, and that's when I did some research and ended up here.
Now, did you go to anywhere else, or did you come to us first?
No, I came here. I mean, I just read the reviews and the interviews and everything online.
Well, I'm a little partial, but you made the right choice.
I know, many years.
Now, like, while you were going through that, did that affect your confidence level or the way you showed up for people, or your chewing? Talk about those things.
Mostly my chewing. It was not being able to eat what I wanted. Like if I had a steak, I'd have to be a fillet. I'd have to chop, cut it up into small pieces. I didn't have any back teeth because all those teeth had gone.
Yeah.
I'd had teeth pulled out when I was small, and so back then they didn't do anything about it. You just lost your jaw, your bone loss.
Yeah.
And that's what it was. I just got tired of it, and it was hurting, and so.
And you didn't have a bad smile with your temporary teeth that you had in the removable teeth. Your smile was pretty good.
Yeah, well.
Wasn't as ideal, obviously, but it wasn't like you walked around without teeth.
No,
you still had a smile.
Yeah.
But did you find yourself covering your smile at all, or not really?
No, not really. People, it's just something that I'd been doing for me so long, and
like I said, and it wasn't bad. You had all your teeth in the partial. So for those of you out there, some people have dentures, some people have partial dentures is what we call them, where they're just missing a few teeth, and that replaces it. But it's something that comes in and out.
Well, that's true, and I couldn't eat an apple.
Yeah.
I'd have to slice it or stuff like that, because that partial was it was a plasticky, a flex one.
Yeah.
So it wasn't hard.
And so you read through some of the reviews for us, and when you came in, how was your experience?
Oh, it was amazing. I thought it was. I mean, the tour, you see everything, how it's done.
Yeah.
Just great. That builds up your confidence right there.
When you can see the technology that we use and everything. You weren't on the tour.
No.
You have to come back for a tour. Okay. You walk down the hallway. But so there's a couple of things that I hear from patients all the time. Now, you just had this done yesterday. So we still have a few months where you'll be in temporary teeth.
Right.
And I think we talked to you about it. It's a soft food diet. So just very soft foods. The implants actually are strong enough to hold kind of eating, but the less you stress them in this temporary phase, the less likely we are to lose an implant or have an issue.
Right.
So the softer you are on your soft diet, the less likely you and I will have to go back into surgery. So be really careful with that. But the implants are actually very strong at this point. The teeth themselves are 3D printed here in our office. It's very new technology. And those can also break in this temporary phase. When we get to the final set, you'll be able to eat anything you want. Apples, eat them how you want them. Okay.
Wow.
Anything, and that's the thing is, you've invested in quality of life. See, what people don't understand is, I can give the same smile with a denture that I can with the fixed implant option. What I can't give with a denture, I can't give the quality of life. Your ability to chew and know that your teeth are going to stay permanently in place. So we just did surgery yesterday. How did the surgery go?
It went really well. I didn't know it was here.
Yeah, that's the way to do dentistry, right? Crap, we missed my
I mean,
appointment.
I could hear movement and talking when you said something to me or something, but other than that,
It was a very comfortable experience.
yeah.
Now, today is the day after surgery. What's your pain level like on a scale of 1 to 10?
Well, before I got these in, it was pretty sore. It was probably a 5 or 6.
Yeah, and what's
But
it
now
like
that I got those in, it's like the pressure's been relieved, and I would probably say a 4 right now.
Good.
Yeah.
So it's slowly coming down a little bit. That's good. We hear everything from 1 to 2 up to 6 or 7. Usually, I very rarely get 8 or 9.
This morning I would have said take them. I mean, it was.
Was it painful this morning?
Yeah, I took some ibuprofen and that is fine.
So, and that's the key is during this period of time, let me get a little water. Sorry. During this time, let me take a breath. Sorry, my voice, I talk way too much during the day. But during this time, I was going somewhere really good with that comment, but I can't remember where I was going. What was it?
Her pain level?
Oh, yeah, thank you. So during this time, it's better actually to just make sure every 4 to 6 hours you're taking your pain medicine. That way you'll decrease the pain that you're feeling. This morning you're probably in a lot of pain because you maybe didn't wake up in the night to take your pain medicine. So once you start feeling pain, it hurts more. So stay on your pain medication and just kind of stay for the next 24, 40 hours. Just kind of religiously take it. There's no point in being in pain.
No.
So if you're taking that, hopefully it'll go down to a 1 or 2.
Yeah.
But like I said, very rarely do we have anybody that's over a 5,
Yeah.
especially if they're taking their medicine. Usually it's 1 or 2, so that's pretty good. But we can kind of ask you, hopefully you'll be willing to do some more with me later, but I'd love to show you your new smile. How's that sound?
I feel like I got chompers.
You finally have some teeth in the back.
Yeah.
All right, so go ahead and take off your mask and take a look.
Oh my goodness.
Oh, don't you look pretty?
Oh my goodness.
Yes.
You have a full set of teeth.
They're perfect. Yes.
Wow.
And kind of bite them. Remember how we said bite on your back teeth? Bite all the way back. Remember, put your tongue on the roof of your mouth and bite down. Just like that. See how
Yeah, I don't have that overbite in
Yeah.
like it was.
Yeah. But you're used to kind of pushing your jaw forward, so you have to get in the habit
Yeah.
of putting your tongue on the roof of your mouth and get used to biting where in the back.
Will your top teeth come over instead of your bottom ones?
Exactly.
Yeah. Will your top teeth come over your bottom ones?
Yeah.
She's just
Wow, I
scared.
got teeth.
I'm so happy.
Oh, wow.
Are you okay?
And you know what? The top ones don't even hurt right now.
That's
it's just
good.
the pressure at the back
little
on
sore.
the bottom. Yeah.
Yeah.
And I got fat cheeks.
They looked so good.
Wow.
And I bet
That's a
you
big
they feel
change.
good because they look like just
I-
like they just conformed to
You're
your
right
mouth.
about the top. You know, my partial went a little ways back, but not a whole lot.
Yeah.
These don't even go that far.
Much more comfortable, right?
Yeah.
So that's another thing that people don't realize when you have
Wow.
dentures, you can't taste your food.
Oh no! Well, I couldn't wear them anyway. I choke. I had that
So you take
device
it out
in there
when you-
before when they were trying to straighten my jaw, and I woke up choking in the morning, and I was drooling all the time, and I said, "Take it out."
Yeah.
I'm not. I don't care.
Yeah.
They did.
Now the
Oh
one
look, I got teeth.
No.
the one thing I like to tell people is, as you're getting used to talking with the new teeth, make sure to read out loud to yourself. If you get to a word that you say different, Just practice it over and over again. Okay?
I was
Yeah.
telling those guys on the phone when they call me in for their orders.
Yeah.
Awesome.
Yeah, my boss came by yesterday and bought ice cream.
Yeah.
But yeah, wow. You're so much better than what I expected.
Yes.
Yeah, from what you expected. Yeah.
Well, congratulations on your new smile.
Thank you.
Thanks for doing this. I know you just had surgery yesterday, but it's important because there's a lot of people out there like you that are suffering with devices that come in and out, or dentures, or they know they're going into dentures, and it's just really helpful for you to share your story that, hey, I'm in a level 5 of pain, but you're not taking pain medicine. So we can even get that lower if you really stay on top of it.
Yeah.
And if you need something a little stronger, we can get you something a little stronger. We want you
No,
comfortable.
I just threw out some hydrocodone this morning. I don't like that.
Yeah.
That's old. It was old. It was from my rotator cuff, but
Yeah.
I didn't take them.
So if you just stay on the ibuprofen and Tylenol, you're going to be in good shape. All right. Congratulations. Thank you.
Thank you.